Welcome to This Week in Hearing, where listeners get the latest information on all things happening in the hearing care space, from device technology to pharma therapeutics to practice management. My name is Amin Amlani, and I have the privilege of serving as your moderator. Historically, the hearing aid industry has seen a modest growth in serving the needs of patients with hearing loss, balance, tinnitus, and other ear-related issues. If we as a profession and an industry want to accelerate this growth in years to come, there's a need to meet consumers where they are. To help us gain a better perspective on this topic, please welcome Rick Rutter, Vice President of Product, Marketing and Innovation at Hear.com. Pleasure to have you today.
Thanks, Amin. Great to be here.
So let's get this thing started and let's talk about what Hear.com is and then what's your role within that organization.
Yeah, so Hear.com, we are one of the largest online retailers of hearing aids. And my role at Hear.com is really to help us increase awareness, education, and help get more people into hearing aids. We're a mission-driven company. And one of the things we really believe in is that everyone should hear well in order to live well. And so that's absolutely something that is behind everything we do.
I love it. Absolutely love it. So I read online that you're also a hearing aid user.
I am. And that's one of the reasons why I actually came to Hear.com is I've seen the struggles, I've lived the struggles, and I've also struggled to get into hearing aids as well, like many of the people out there. Ever since I was a little kid, I had hearing loss. And I ended up trying hearing aids for the first time when I was in my late 30s. And so, yeah, I struggled in school. I struggled in my early career. I made up for it in different ways. But at the end of the day, without hearing aids, it really does make it difficult. And many people don't realize that until you actually try them for the first time.
Well, it's a wonderful story that you have, and I'm glad that you're in the field because you can tell from both sides of the coin what's happening, both as a user and then also as a provider to these other practices as you're helping them grow and provide services to their patients.
Absolutely, I love being able to have that empathy for our customers, and I think that's one of the things that really helps us do a better job in educating and helping them see the benefits of the technology today, because it's come so far. But it's amazing that many folks still hold on to the stigmas of hearing aids from way back in the past.
Yeah, no, absolutely. And I mean, I think that's one of the next things that we're going to talk about is, and I'd like for you to talk about this maybe from an industry standpoint before we get into it from a personal standpoint. And that is, what's the biggest barrier in your perception that we have that keeps people from entering this space? For
some crazy reason, people think that hearing aids are going to make them feel or look old. And I think it's that stigma of hearing aids equal old age that keeps so many people from getting the help that they need.
Yeah. Was that part of the reason that you waited such a long time?
Yeah, it's interesting you say that because in my case, I actually had a medical condition. So I had cholesteatoma, which was the reason for my hearing loss. In my situation, I had looked at different hearing aid options when I was younger, but when I did, the sound wasn't right. It didn't feel natural. But that was 20, 30 years ago. So the technology has come so far that it really is a different game these days.
Yeah, no, absolutely. And I know that you guys have I've looked at some of the materials that you all offer, and you've got some really, really nice educational materials. Can you talk a little bit about that and how that's being used to engage the patient with the provider?
Yeah, I mean, I think one of the biggest things in terms of education is we show what modern hearing aids look like. Many of them are, extremely small. They fit directly in your ear. No one would even notice that you're wearing them. So I do think that even showing a lot of the newer devices in different ways is one of the things that helps people kind of change their perception a little bit and think about giving them a try. But then the other piece is, I think it's a very complicated purchase. or complicated process. And so that's why at Here.com, we really hope to try to handhold a lot of our customers, educate them over the phone when we talk to them, let them know about the reason that they need medical grade hearing aids, and not just amplifiers or other devices that may be marketed as hearing aids. We help educate them on the various technology levels. We help educate them on the reasons for working with a professional to fine tune and program those devices. And I think until people realize the value that comes out of modern hearing solutions, it's really difficult for them to justify the price sometimes.
Yeah, no, absolutely. And as you pointed out, the technology is so much better today than it ever has been. And, the opportunities for individuals to hear better these days and to be able not only to hear better, but also to communicate with their smartphones and these other things has really, really, I think, allowed for us to maybe permeate some of these other folks that may not have entered the market, younger folks that we're starting to see hopefully enter more and more as these baby boomers start to transcend through the space here.
Absolutely. And I mean, I think there's also a lot more research these days on the benefits of needing to hear well. There is tons of research out there on the negative effects of cognitive decline, or even dementia that can result from not addressing your hearing loss, and the fact that hearing aids can help with that. And even having some of that research to allow people to know that this is a problem, not just with being able to communicate, but with the way that your body functions and the need to live a long, healthy life. There's so many reasons for people to make the right choice. But that, to your point, we've just got to increase the education. We've got to help increase some of the awareness of all the things we're learning about hearing loss and hearing aids and the reason people need to get a solution for that.
Yeah. No, that's a great point. The other aspect of this is accessibility, and we know as an example that not everybody that needs treatment is getting treatment. One of the factors is we have a shortage of audiologists and hearing instrument specialists that are providing services, but then we also have patients that are in rural places that can't always get the help that they need. And so I know that there's some solutions that Here.com has available to help reduce this barrier of accessibility. Can you share that with us?
Absolutely. And it's super exciting. And I think even some of the challenges we face with COVID, and even the fact that we're doing this interview virtually, starts to speak to the technology that's available, not just in the devices, but in the way we can deliver care. And for us, we've been experimenting, or not even experimenting, but using teleaudiology services for years. And now with COVID are not only able to accelerate that, but also able to your point, start to bring more accessibility to folks in a variety of different rural areas who would not have access to care, or would have more difficult access to care without such solutions. So not only are we really excited about it, but it's also proven to be really successful. And I think it's something in terms of convenience that not only works with folks who are rural or inaccessible locations, but also for people who just want convenience and ease of use. And so teleaudiology, I think, is one of those areas that is really exciting and allow us to think about, how can we deliver a better customer experience to everybody out there? And that's one of the things that goes towards our mission, right? Of we really do want everyone to hear well, to live well, and we've got to figure out how to solve all of these problems.
Yeah. So you said something that just triggered something for me, and that is there are some providers that just haven't quite adopted telehealth as a potential opportunity. If on this platform here, is there something that you would say to these folks that might get them to maybe reconsider where they're at today?
I mean, one of the things we believe at Here.com is to always put the customer first, right? Always put your patient, or, always put that person, at the forefront of some of the decisions you're making. And, we all have businesses to run, but at the end of the day, many times we're doing it for these folks. So I think, the one thing I would highly encourage people to do is to think about, how we can help as many people as possible. And I think for folks who are, don't have the access to care, or folks who want a more convenient solution, I absolutely think we need to think about all the available options, and telehealth is absolutely one of them.
Absolutely. And I think as a provider, you have to be dynamic and get away from the static of the traditional model, because there, as you pointed out, there are some folks that are just going to want the online version, and there are other folks who are going to want to come in, and you have to be fluid in order to treat these individuals, which again goes back to your mission and is also the mission of the profession as well, to help those individuals.
Yeah. And I think it's really interesting because we all have to evolve. I mean, things are changing, and what we're dealing with in COVID has definitely expedited a lot of the evolution of an older audience towards digital and being more open to things like videos. My parents now regularly Zoom with their grandchildren. My dad, we actually fitted with hearing aids using teleaudiology. And it was really interesting because even for someone with a son with hearing loss who wears hearing aids, and also understands a lot of how to like educate and drive that. My father struggled, a man in his 70s with, I don't want hearing aids, they're gonna make me look old, right? I'm like, Dad, come on, let's give it a try. I've got an exciting opportunity for you to try. And we put him through our telehealth journey. And, the day he was fitted with hearing aids, I get the call, son, you were right. Thank you. Thank the team at Hear.com. And I mean, I'm going to start to cry, but it's like one of those things where it's like, this will change my life. I had no idea what I was missing out on. And it's those kinds of things that I think fuel me, fuels our team, fuels so many people in the industry, right? Because that life-changing moment, it can happen in person, it can happen over video now. Things are so much different. And I think we have to embrace that change to grow.
Yeah. No, absolutely. Absolutely. Well said. The other thing that's changing is this whole direct to consumer market that we're starting to see with, Bose coming to market and some of these other larger electronics conglomerates. So my first question to you is, how big is this consumer electronics market? Do you have a sense?
That is huge. I mean, if we were just to think about doing the math on some of it, right? Which, I've seen so many different numbers out there, but let's just assume there's 30 million people out there with mild to moderate hearing loss that could use hearing aids. I mean, you're talking about a, couple $billion industry, right? I mean, there's so much opportunity out there. And so, from a business perspective, like absolutely that this is something to go after. And I think for us, for anybody in the hearing care space, I think it is just important for us all to really amp up the education, what these different devices can and will do. I think that's when we think about direct to consumer, for us at Hear.com, we want to be able to find solutions for everybody, regardless of budget, regardless of lifestyle, regardless of hearing loss. And I do think these kind of initiatives help us in a lot of ways to do that, bringing new solutions to customers and finding new paths and avenues. So I think that's very exciting. But I also think it's important that we also educate folks on, what some of these devices are, and depending on their hearing loss and their needs, what are the best solutions?
Yeah, no, absolutely. And I think the other thing that needs to happen is, the service provision piece. Folks who are both providers and patients need to understand what their needs are. So, for example, I'll use my dad. My dad has a smartphone. Dad doesn't see so well. So his abilities to do things on his own are sometimes compromised just because he doesn't have the vision. But if you get somebody, for example, that isn't quite sure whether they need the service component or that they need the self-help component, what would you say to that individual?
Well, I mean, I think one of the things we tell a lot of individuals is hearing loss is not a problem of volume. It's a problem of clarity, right? And so I think the things that I would primarily let people know is that you have to be careful about any kind of device you're going to be putting in your ears, be putting in your body. And if we simply put a device in our ears that amplifies all sound and isn't customized to our specific needs, there actually is some danger that you could do more damage than you could do good. Right. So that's one example of where I do think we have to ensure that people are educated a little bit on the technology and the solution, and that, anybody playing in the D2C space like has some level of provisions that account for that. I also think that like one of the things that we always should be concerned about is a bad experience. Because if the devices aren't tuned to their needs, if they don't deliver the experience someone's looking for, are they going to give up on addressing their hearing loss because it
Yeah.
just simply didn't work? So I think there's so many benefits to going direct to consumer, but I also think there's a lot of concerns as an industry, and just like how we care for our population we need to think about.
Yeah, no, absolutely. And I think in some instances, having these devices on the market, again, competition will hopefully allow for these individuals to try these devices when they otherwise wouldn't have, assuming that they have a decent experience, because some of these devices, as you pointed out, are not tailored directly to their loss, but they may get some benefit, will then allow them to say, you know what, I need to upgrade from this lower end technology to something that's a little bit better, that's now going to allow me to hear in a restaurant or those kinds of things.
Yeah. Well, and some of these devices are going to allow people to self-program, right? And you could actually work through an onboarding and, self-program some of those devices. But I think, many times when that happens, it can easily go awry if you don't have like that. That's what professionals are for, right? To really understand the intricacies of the devices, of the hearing loss, of all the different ways that we can adjust and fine tune some of these devices to make it just a natural experience for folks, and something that gives them the benefits they need. So yeah, I do think it's a tricky one, but overall it's a good thing for the industry.
Yeah, yeah. And I'll just ask this question, with your patient journey, and I know hindsight is 2020. If a product was available today, for example, the Bose device or the AirPods or whatever, where you can amplify sound, do you think that might have shortened the time from which you actually started with amplification, as opposed to waiting that long time that you did?
I mean, probably. And I think one of the things for me that kind of held me back in the early years, at least as a young professional, was the cost. So if there was a lower cost alternative to try something, absolutely it would have been something I would consider.
Yeah, yeah. It's a very interesting time that we have in the field, and I know that there's all these things that are starting to emerge in the field. If you could tell practitioners one thing today, as we're looking ahead, and of course we don't have a crystal ball, we really don't know what's going to happen, what would you say to the audience?
I mean, I think the biggest thing is to be open, right? Be open to change, be open to experimentation. Really think about like all the different ways you can meet that customer where they are, right? Or meet that patient where they are. I think there's so much new stuff out there in terms of how people are thinking about hearing loss and hearing aids, and even just the way that like society in general is looking at like hearables, wearables, et cetera. Like, no longer are some of these outdated perceptions going to continue, mainly because it's not a big deal to have something in your ear these days, right? So I think we have to be a little bit more like fluid in how we think about this, and approach it in a way of really think how can we solve these folks' problems, and really think about innovating in order to do that.
Yeah, no, you're absolutely right. We've got a great opportunity in front of us with awareness. Folks are starting to look at the hearing care space. They're using this technology or variations of this technology on a day-to-day basis. I think our future is very, very bright. And knock on wood that we'll be able to meet the consumer where they are, treat more of these individuals so that they're getting the help that they need. And it improves their quality of life, and people are able to live longer and have those relationships that they long for.
Yeah, I mean, it's my hearing aids have made such a difference in my life. I mean, they truly have changed my life, and I think if we can provide that to more people, I mean, that's what we're all about at here.com. And personally, it's something I strive for. So couldn't be more excited about what's to come.
Wonderful. Rick, it's such a pleasure to have you on the show this week. And we look forward to having you on the show, hopefully at a later date.
Well, thank you, Amin. It was a pleasure as well.
Thank you.